Dan here said we can tell stories.
We're going to tell.
Okay, I'm out of here.
Oh, yeah.
I think that's a guy thing. I guess I don't need to take up 3 chairs.
Oh, I think you're
I told him we came for the steak dinner.
Oh. Oh. That wasn't in the.
Wasn't it?
The fine print.
Fine print, yeah.
Very.
I'm going to wait I'm going to wait 1 more minute and then we'll get started.
Dan, I think you got taller.
Maybe. I'm just trying to stand up taller, maybe.
Thank you.
Yep. We got 2 people already signed in at home, so we'll see. I'll wait 1 more minute and then we'll get, and they can always review it online. So.
So, only 4 people left?
Yeah, I should have brought some to take notes. Do you have any paper that I can take notes?
I do, yep.
I got it.
I just have some blank copy paper.
I'll have a piece too.
That'll do
Okay,
the
thanks,
trick.
this is kind of small. It's kind of easier to write it.
Yeah.
I'm good.
You good? Yeah, good.
Thank you.
Yep. There you go. All right, well, let's get the show on the road here, shall we? Whoever's late, they can catch up later.
It's easier.
Looks like that's recording. Everyone can see me at home, I hope. I usually like to stand right here. No.
Do you want us to move it?
No, you're fine, you're fine. I really only have about, honestly, talking so quietly today, about a half an hour of material, but I think what hopefully will happen is we'll just kind of digress into different avenues that, based on what you want to know about, essentially. So you kind of just guide me on what, if we catch a slide that we need to expound upon, we can do that. And if there's something there, a slide that pertains to nobody here, we'll just skip it and go on to the next one. So, and then I'm going to just put these coupons by the door for those that, if the other 2 people show up, I'll grab that. So I kind of congealed, if that's a word? Sure, we'll use that. About 10 different seminars from the past into this one. It's like, we never really talked about constipation directly, but in a lot of my other seminars, we touch on it, and then I say, oh, we'll cover that later. And so now here we are. It's later, we're gonna tackle this. I really usually I have like 100 slides. I think tonight I've got 20. So, but we don't want to overcomplicate it if need be. So, and I'm going to take it, as you know me already, a very natural approach to this and a very functional minded approach. So back in my traditional pharmacy days, it was just, there's the fiber and laxatives and here's some DocuSafe and so forth. And not that that's wrong, but in the world that I live in with root cause analysis, trying to figure out exactly what's going on with the patient, I go after that first. Let's figure out why the patient's constipated in the first place, and then see if we can fix it. If we can't, then, okay, maybe we do some over-the-counter, whatever, OTC stuff, right? That might be helpful, or let's look at lifestyle, diet, let's do some of that. If all that fails, okay, I've got magnesium we're going to talk about tonight. We've got a natural fiber we'll talk about tonight. We can do a detox cleanse. We could do, then that's what we might just kind of trickle into some of those topics tonight. So that's where we're heading essentially. So I think, again, my medical disclaimer, and again, those that are listening online, I'm not a physician. So if you're on a regimen for your constipation issues, don't leave tonight, or turn off your computer at home and say, okay, I'm going to just stop this because Dan said it's okay. That's not what I'm saying. Go consult your physician. So we're all clear on that. These are just my opinions, essentially, is what that last slide says. Constipation is a huge issue. Every day in the booth, I'm meeting with somebody, and I always ask them that because, and one of my slides, we'll get to this towards the end, is we deal a lot with bioidentical hormones here and thyroid. And majority of those patients have thyroid issue or constipation issues. So if you have a thyroid issue and a sluggish thyroid, you're, not that it's a guarantee, but you're at higher risk for a sluggish colon, which is unfortunate. With all the other crummy symptoms you have to deal with low thyroid function, so we get to add constipation to the list. So I think these numbers are pretty conservative, but about 15% of the population, adults, that number's coming from, are suffering with constipation. If you look at some of the numbers and data out there, that number probably doubles when you get to patients that are over 65 or 60 years old, is what I have on here. We are excluding children in this talk tonight, even though there's one teenager. 14. Yeah, 14, okay. And I will tell a story, one of my stories about my own kids, so sorry, I won't tell you which kid of mine, I'll leave her name out, but we'll get to that story later on about pediatrics kids, and there's some little tricks we can do along the way to help them as well too, if need be. And we're not going to talk about constipation and pregnancy tonight, that's a whole other category, so we're going to leave that out. So what is constipation? Just, I'm sure we all know that, but we're going to just briefly touch on that for a few moments. Symptoms of constipation, I think we can all figure that out on our own. We'll hit that. Causes, hopefully some new material I'll present tonight on some things we might not think about that could be causes for constipation. So we'll spend a lot of time on that, or a fair amount of time, I should say, and then some treatment options. Again, that we'll spend probably the majority of the time of, okay, I've got this issue, how do I fix it? You know, I think that's why we're all here tonight. And then pillars of GI health, I'm going to touch on that towards the end too, of, okay, we fixed our constipation issue, how do we keep it from coming back? So there's all kinds of different ways to maintain GI integrity, so we're going to look at just a few of those tonight. So what is constipation? So we can all come up with our own definitions. I'm sure they all would be relatively the same, but I just put down infrequent bowel movement. What do I mean by that? If you're going less than once a day, that's infrequent, put it that way. Difficulty passing stool, hard and dry stool, excessive straining, that can lead to, of course, wonderful hemorrhoids. So that could be a problem and then lead to more problems. Generally defined as fewer than 3 per week. I think that's a bit much. I would say fewer than 5, 6 per week. That's what my definition is. But this is a definition I pulled off of one of the medical websites. So we'll leave that up to interpretation. Causes. There's quite a few different causes out there. Some of the ones that I think are pretty self-explanatory, but if you have a blockage, you know, there's some kind of issue structurally in your GI tract, okay, that could be leading to some issues of constipation. This nervous system that wraps around our whole GI tract and the whole peristalsis and the movement of the small intestine and the movement of the large intestine and so forth. Maybe those nerves got damaged. Maybe there was some kind of damage from a surgery. And I see that a lot with post-surgical issues, and patients come in and they're coming in for other reasons, but then I'm asking them questions. I'm getting the medical history from them. Oh yeah, I had a surgery 3 years ago and I've never been able to go the same since. So there could be some issues there just in the torso with surgeries and whatnot, mucking up the nerve, how it integrates into the GI tract. Dysfunction of muscles involved in elimination, so that could be an issue too. How is the tone of the smooth muscle tissue of the GI tract? Is that a problem? Is that all where it needs to be and so forth? We're going to touch a little bit on muscles and smooth muscle tissue tonight and how that works. And then a little bit on causes. I already touched on hypothyroidism. So that's one of many, but in our pharmacy here, I'm just talking in what I see mostly day to day is low thyroid function. We see a fair amount of diabetes here, not too much, but that too, when you get to that diabetic patient, they're overweight, potentially, not always, but could be. But then also what happens with diabetes, whatever that patient may look like, what ends up happening then with diabetes, the way I think of it, or the way I explain it in a very simplistic way, you've got high blood sugar, and the electrical system, excuse me, or the nervous system of your GI tract starts to rust out when there's too much sugar in the blood. And so when you have high blood sugar, sugar and nerves don't mix. I always think of sugar, if you were to put sugar on the electrical system of the body, that electrical system will rust out a lot faster. And you see that with neuropathy and tingling of the hands and feet with diabetic patients. You just don't feel that per se, other than with constipation with a diabetic patient, that their GI tract is slowing down because their nerves around their GI tract are getting worn out faster. That's the way I think of it. So if you know of anyone that, constipated, you're diabetic, it could be, again, root cause. You're not being managed well with your blood sugar. We need to figure out a better plan to get your blood sugar down. There's other things too. We won't get deep into that tonight, but that's something that, again, let's do a complete medical history on a patient, find out everything about them, and then start checking off the boxes and seeing if any of their previous medical history is contributing to their constipation. Because sometimes we just go into the doctor's office, say you have constipation. I'm making up a story now, scenario, but you walk out of the doctor's office with a bottle or a prescription for Miralax or something like that, or some DocuSafe, which again, I'm not saying is completely wrong, but it might not be the best option. So yeah. So we got to look at those causes. Risk factors. There's a lot of different risk factors. I mentioned a few of them already, but being female, and part of that is because of hormone imbalance, but then also with hypothyroid or low thyroid function, the majority of women, the majority of patients with hypothyroidism are female. I don't know the exact numbers, but I think it's 80-90% of those with hypothyroidism are female. Age, as we age, I talked about that already, that incidence goes up. Another risk factor, dehydration. So I raise my hand for this one. I don't drink enough water. It depends on who you talk to, but you want to be drinking at least half of your body weight in ounces of water each day. And so I'm about 180 pounds, so that's 90 ounces of water. Divide that by 8. I can't do the math, but whatever, 11 glasses of water a day. I don't even get close to that. As I'm drinking coffee during this seminar, which is a diuretic, right? I'm dehydrating myself as I talk here. Do what I say, not what I do, right? Low fiber diet, I'll raise my hand for that one. I definitely do not get enough fiber in my diet. If you're going to start with fiber, I don't have a fiber slide, but if you're going to start on fiber, I do recommend that. I've got a colleague, I won't use his name tonight. We'll call him, I don't know, Bill. But a friend of mine up north started him on fiber capsules, just a few of them a day, and I told him to increase it gradually and then drink more water with it. And within a week, much improved just with fiber. So, low physical activity. It's another problem. So again, it's kind of, I'm not going to specifically name my kid, but playing outside, I don't know. And then they're sitting around the house all day, and then Dad gets home and we go run around and play outside. And then like 10 minutes later, I got to go to the bathroom. Like all of a sudden, like the heck. So, but my point is, again, get to the root cause. I mean, you take a walk around the block, or get outside and exercise. And if you're not doing that, at least add this to your regimen or your habits, so that at least you can cross this off the list that it's not, your constipation isn't due to inactivity. Medications. This one I could spend all day talking about. Just this, even when I worked regular retail pharmacy and I was filling 600, 700, 800 prescriptions a day, which is nothing. I mean, it's just crazy. But all the medications that you'd have to sit there and counsel every patient on. Oh yeah, by the way, this can cause constipation. This can cause constipation. I mean, like almost every drug class. Like I'll name a few, but like there's the narcotic pain medication that would hopefully probably be obvious to most people. Beta blockers, so blood pressure pill. a lot of people on beta blockers, metoprolol, atenolol, calcium channel blockers. Both of those, so beta blockers and calcium channel blockers, those have, again, a significantly higher risk of constipation as a side effect with those two. Sedatives, I won't get too much into that, but that's a possibility. So again, my point with the medications here is look at the list, bring it into me or someone that's well-versed in, again, figuring out what medications cause constipation and what's the rate of incidence on those medications. And then let's see if we can talk to the doctor and possibly get it switched. If you're on a beta blocker for blood pressure, well, maybe we can switch it to an ACE or an ARB or some other drug class that doesn't have as high of a risk for constipation. So, antacids, then I have a whole lecture on proton pump inhibitors and drugs for heartburn and acid reflux. And my favorite one that I listed here, the proton pump inhibitors, they can cause a lot of constipation because they deplete our body of magnesium, and we need magnesium to help us go to the bathroom. I have a whole slide on magnesium coming up, but again, I'm not saying that it's always the cause, but at least let's look at it and see if it's an issue. Calcium supplements, when I went through the pharmacotherapy class in pharmacy school about bone health, we were educated on, if a patient comes in, they have osteoporosis, and we're going to put them on these medications to help preserve their bone. Oh yeah, and by the way, make sure they're on calcium and vitamin D. Well, what calcium do we recommend? Oh, just give them some Tums or calcium carbonate or something like that. It doesn't matter which kind. And I was like, really? Doesn't matter which kind? Okay. It does matter which kind, of course, right? So you want a good absorbable calcium. If you're not absorbing your calcium, or I put on here your iron for that matter, if you're not absorbing those two minerals and they're going to just stay in your GI tract, they're going to cause constipation. So I see that quite often. I don't have a slide on this, but I will say just briefly on iron supplementation. I see that a lot, that patients, even when I worked regular retail pharmacy, patients were very, especially if they had constipation issues already, and I was recommending an iron supplement for their anemia, for their low red blood cell count. They'd be like, no, I don't want to take that. I'll be constipated even more. Well, you're anemic. Like, you gotta, what are you going to do here, right? If you give the patient the right type of iron, you're going to fix both issues. You're going to fix their anemia, and you're going to fix their constipation. And here's a little trick. And this doesn't work all the time, but if a patient is low on iron and they're hypothyroid, sometimes if you actually measure their ferritin level and their ferritin level is low, you can give them iron and their ferritin level will go up. And when your ferritin level goes up, your thyroid function improves. And when your thyroid function improves, you have less constipation. So you could actually, with a hypothyroid patient, not all the time, but give them iron, and it'll fix their anemia, it'll fix their thyroid, and it'll fix their constipation. It's like 3 for 1. That's really cool.
So what blood test would check your ferritin?
It's actually just called the ferritin blood test.
Oh, okay.
Yeah, like if you do I guess if you go to your doctor, I would ask for a complete iron panel, and then you just specifically have to say, can you measure my ferritin? The issue with ferritin is there is such a wide range, and I can't remember don't quote me on the numbers, but I think the bottom of the range for ferritin, I think is something, oh gosh, I'm going to get this wrong, but 30, I think, and then the high end of the range for ferritin is, I think, 200. And ideally, I want to see that ferritin level for somebody that has low thyroid function above 80, or around 80 to 90 or above. So you can test your ferritin and be at, like, let's say 40, 50, or 60, and it'll show normal. But I would argue, if I put those 3 things together, if that patient's constipated, if they have hypothyroidism, and they're slightly anemic even if they don't even have any anemia, let's just put that one out. But if they have low thyroid function and they have constipation, I'm going to check their ferritin, and if that's low, I'm going to recommend the right type of iron that's absorbable to fix both of those issues.
Cool.
Even though most
I might have that test.
okay, yep. So, all right, so risk factors, there's the list there. All right, so let's get into some treatment options here. So I did So prevention is the best strategy, right? Let's not get into this predicament in the first place. So we touched on a few of these already, but change your diet. So again, I could tell you a story of I think she was 8-year-old at the time, and she was having constipation issues, actually along with migraine issues as well. So that's kind of the key part of the story. She was having those two issues, those two symptoms. And so we were doing some basic things for headaches for an 8-year-old, and then for constipation, you got some real basic things. And I actually was giving her magnesium because that's my go-to for just about everything related to constipation. I always start there. And we did that, and nothing really worked. And so we actually did a food sensitivity test for her. And lo and behold, she was sensitive to a multitude of different things, but the two main ones were gluten and dairy. So we cut out her cheese and we cut out her dairy. And so the migraines, the headaches went away, and so did the constipation. Dairy is very constipating.
Yeah.
But it's a subtle effect. You may not notice it. I mean, if you've always eaten, let's face it, right? We're in Wisconsin. I've lived in Wisconsin my entire life. I mean, I grew up eating cheese. And so we may not know any different, right? Like, again, just making up a story here, but let's just, we've only gone to the bathroom every other day for our entire lives, and we think that's normal. But we're also eating dairy or consuming gluten or whatever it may be. Root cause, let's just figure out if we have food sensitivities in the first place. I mean, you might come in and say, well, my diet's fine. I don't have any allergies. Like, I don't have a nut allergy or whatever. I'm not celiac. I don't have a true gluten issue. But yet you're constipated. Maybe you have migraines. Maybe you're on migraine medication, whatever it may be. If we've gone through, let's just say you've done the OTCs and all the stimulants and osmotics and all those other things, and nothing's working, again, I would peel back all the layers and start here. I'd go, okay, well, let's find out if there's a food that's causing your constipation. And it doesn't have to be I use the word sensitivity here, so it's not a food allergy, but a sensitivity. I'm not going to get deep into that, but there's a difference there. So change your diet. Increase your fiber and water slowly. So that's important to do that over a series of weeks is what I would say for that. Eat fewer foods that are low in fiber. So I touched on this a little bit. Dairy is a good one. There's very little, if any, there's no fiber in dairy, right? Or in meats. So if you're on a ketogenic diet, a lot of patients, and I was on that for about a year and a half, and constipation was an issue. I actually would take fiber supplements so that I would get enough in my diet. So that's one of the side effects of a keto diet.
So you're saying meat is on which side?
Meats, So eat fewer, eat less meat essentially.
Meat is low fiber.
So if you're doing like a Atkins diet or a keto diet, you're eating a ton of meat. You could do the protein. Protein's good, right? So organic, grass-fed, all that kind of good stuff for your meat. But then load it up. The other side of your plate's going to have to be a lot of fiber, a lot of vegetables, and non-starchy vegetables, though, right?
What's non-starchy?
Non-starchy. So, in general, vegetables that are grown above the ground. So broccoli, cauliflower, all the greens, that kind of stuff. That's how I think of it that way.
That's what did you say about those?
Those are the ones you want to consume for vegetables. For if you're eating a lot of protein, balance that out with a lot of vegetables.
So broccoli.
So broccoli, cauliflower,
What about
a lot of salads, Brussels sprouts. Yeah.
A sweet potato.
Too much starch.
Okay.
Yeah.
Peas?
Whole fiber. Peas would be fine. Yeah. Increase your daily exercise. We touched on that already. And then make that a habit though too. So not just like, I'm just going to go exercise on the weekends and then during the week I'm too busy. Try to find, even if it's 5 or 10 minutes, just something to get blood flowing and moving around. Manage stress. Easier said than done, right? There's a whole book by Emmer and Mayer about the whole gut-brain connection. Managing stress, and there's more serotonin in your GI tract than there is in your brain. So serotonin is a neurotransmitter that strongly connects the gut in the brain, and serotonin is also that happy, one of a few of those happy hormones, happy neurotransmitters. And we say in the brain, but it's also in the gut. So, right, we want to make sure that we're not overly stressed out, and then we're releasing a lot of norepinephrine, epinephrine, and that's that fight or flight neurotransmitters. That's going to slow down your GI tract. But when you're in that stressful situation, your body's like, yeah, I don't need to go take a crap right now. I need to figure something else out, whatever that stress is. So it could be a multitude of different things, but your GI tract slows down.
I like the sticker on that water bottle.
That was from one of my kids. Thank you. What is it? That's
It's from like a mobile game.
That's what. Yeah. I don't even know what that game is called. But yeah.
It's called Among Us.
Among Us. Thank you. Yes. Don't ignore the urge to go to the bathroom. I feel like I tell my kids that, like, you have to go to the bathroom. You gotta go to the bathroom. So create that regular schedule. That's important as well too. I'm developing habits in this. Is a key point with this. All right. Traditional approach. This is what I was trained on in pharmacy school. Was the kind of those OTCs, the laxatives, the osmotics, your polyethylene glycol. Those are your Miralaxes of the world. Those kind of things that you take this polyethylene glycol, this Miralax powder, you mix it up, right? And you drink this solution, and what that does is it draws once that polyethylene glycol gets into the colon, it naturally draws water towards it, and then it gives us that laxative effect.
But probably not good if you're dehydrated.
Correct. That's a good point. Yeah. So you got to drink more water. Yeah. But then you got to follow that up with electrolytes, because if you overwater yourself, you dilute your electrolytes. So I'm a big fan of like sea salt. And replace, not just drinking plain water, but getting electrolytes in there too. Your cholase is like your surfactant that kind of help. Essentially, the way I think of cholase or a surfactant is kind of like breaking up that juncture between the stool in the large intestine and the epithelial wall of the colon itself, and just allowing that stool to pass more freely through.
What is the cholase?
Cholase, that's just a brand name, but
I mean, what is it? Like, what do you buy that has cholase in it?
well, that's the brand name for it.
Oh.
Yeah. I can't think of the generic name for it off the top of my head. I haven't dealt with that in forever, but and then your Senecot of the world is your stimulant. That's going to actually help to basically move your colon along to get this the constipation issue fixed. And then you've got your enemas. Now there's saline and water enemas. I only recommend this, not the saline, but just the water enemas, especially for the elderly. You do saline or salt water, and basically salt water enemas, and that can be very problematic for elderly patients for sure.
What age is?
I know, right? I'll leave it up to interpretation. I'm not going to give a number or an age yet. Right. I'm going to live to be 120, so over to 100. All right, so the functional medicine approach, this is the kind of the world that I live in, is, okay, what can we do from a natural standpoint? Talked about fiber, so fiber kind of plays both sides, but if I do fiber, like the one that we have on the shelf, I don't want to get too promotional here. I mean, you could essentially pick anyone that you would like. I don't even see it open here.
When it says with hydration, does that mean you're drinking just lots of water?
Yep, drink it with a glass of water.
Okay.
But Ortho makes ones like a psyllium husk fiber blend, and just drinking that with water. Botanicals, Cape Aloe, Cascara Sagrada, and Senna, those are stimulants. So I have a slide coming up, I think on the next slide coming up, I'll talk more about super aloe.
Like, is aloe juice like really good for it?
Not aloe juice, but Cape Aloe. So that's a good question.
Okay.
Yeah. Probiotics, we have a whole slide on that, and then chelated magnesium. So let's kind of delve a little bit more into each one of these here. Oh, here's a picture of the Fiber Plus. For some reason, I don't have it on the shelf, but nonetheless. So here's Super Aloe. So Super Aloe, I think of, okay, somebody comes in, we sell a ton of this, and again, this is just one product of many, but if somebody needs a stimulant, they are, I kind of go through the list with them already. They're drinking enough water, essentially. I mean, it's subjective, but they're exercising, all of those things. They're not eating a bag of cheese curds for lunch, kind of a thing. Like their diet's relatively okay, and they're just constipated for whatever reason, unknown to them. But so this Cape Aloe acts as a stimulant. It'll actually just help that peristalsis, so it'll get that colon moving and push in the stool through the GI tract. And so the trick with Super Aloe, though, is it's a little touchy, in my opinion. So I always tell patients you're going to take one dose before you go to bed, and then hopefully you go to the bathroom in the morning. If you don't, you're just going to take one capsule per day until you do. And usually within 2 or 3 days, you're good to go. Usually, majority of the patients that report back to me with after that first dose, they're good. Some patients have to stay on that just because they get like a lazy colon essentially, and so they need a little bit more. But the trick with that is I'm developing a program for them so that they don't get addicted to this, because their colon can get, where they have to take it all the time, and I don't want that to happen. So I'd say smallest dose possible. It says anywhere between 250 and 900 milligrams. I will tell you, I've never recommended over 400 milligrams at one time. I don't go more than that. I mean, I've had, again, talking about stories, I could tell you some awful stories of patients taking too much of this. Actually, not even patients, but having even coworkers. This was years back. That were, one didn't work. So then like 4 hours later, I'm going to take another one. And then, the explosion happens, So, but timing is critical. One before bedtime. I just said this, but I'll read this out loud again anyways. Adding one per day until bowel movement in the morning. So as you read this, you could actually, take one on day one or night one. And then if you don't go to the bathroom that next day, you could actually take 2 all the way up to 900. I usually don't recommend that. So I go super slow.
250 milligrams?
There's a 250, and then there's also I believe it's a 400 or 450. So there are some adults that will just come in here and they've kind of been around the block once or twice already, and they just grab the 450 right away. I always kind of think of this as the pediatric dose, but I still, I'm cautious with this one. So unless I know a lot more about that patient, then if I know very little, I'm going to just recommend the 250 to start. It's a safer bet. I'll sleep better at night, and the patient will not yell at me the next day. I have a big problem. It says, this is your product to get things moving when treatment is initiated. Then use it as a rescue or like a PRN as needed. So you're not going to stay on this Super Aloe all the time. Let's say you go on vacation and your diet and everything, your whole routine gets mucked up, and you come back and you're constipated. This is my go-to kind of for that situational kind of issue. Don't use during pregnancy and breastfeeding. I'm not going to get into the whys behind that, but you're excluded from this product if you meet one of those criteria. Motility Pro. I have a lot of success with this particular product, especially patients that, I don't want to say diabetic, but we talked about it a little bit before, that I just want to say sluggish GI tract. I'll use 55, 60 years old, older, maybe a little bit overweight, maybe that pre-diabetic patient, that kind of thing, where I'm making some assumptions, but their nervous system might not be as well functioning as it should be. And so that Motility Pro, as the name says, it helps the small and large intestine. It helps to get it firing and moving. It helps the nerves to kind of wakes them up again, essentially, is the way I think of it. It's got ginger and artichoke in it. It's a very basic ingredients. The ginger binds to receptors in the intestines to help move them along. And then the artichoke acts as a stimulant to get bile released. And then that helps to get it's a natural lubricant for the intestines, help get things moving. So very simple product. Use that quite often. Dosing varies. Depends on the patient and severity, but if it's a mild case, I just might even just use one per meal, I'll say. Sometimes I'll have to bump it up. This says 1 to 2 per day. Sometimes I get a little bit more intense on the dose if the patient needs it, but case by case basis for dosing on that. And then my go-to, if a patient comes in, if they come in and they're asking for help with constipation, the first question I ask them is, how are you sleeping? Because if you're not sleeping well, if you're sleeping like crap and you're not crapping, then you need magnesium for both of those situations. You need the magnesium so that it acts as helps with that smooth muscle contraction. But then also what the magnesium is doing is it's helping you sleep better. And when you're sleeping better, you're more relaxed and you're able to go to the bathroom in the morning, essentially. So kind of a win-win there. That's probably the top, out of all the products that we sell here in the pharmacy, that's got to be the top 3. And usually, almost everyone I recommend magnesium for. And it helps with a multitude of other things too. It helps with anxiety, helps lower blood pressure, and there's a million other things that magnesium is good for. So I personally have been taking magnesium, not for a constipation issue, not to get too personal here, but I just take it for the stress relief benefit to it. It does help with my muscle tension, and it helps me sleep better. So I take, again, I don't want to give out too much for protocols per se, but from a dosing perspective, it's 2 capsules at bedtime is where I'll start out most adults, and then go from there. And if they're stressed, they're still anxious or what have you, the following morning, I might have them take another dose in the morning too, depending, or wait till even lunch and then dose it again.
How's reactive magnesium different than like magnesium citrate?
Yeah, great question. Yeah, magnesium citrate. So magnesium citrate's fine to use for constipation, but then if you get too much of it, you get to that point of no return, and then you get the diarrhea effect. Where this has 3 different types of salt forms of magnesium, and so again, the way I think of it is that the more salt forms in a particular product of magnesium, there's different areas of the GI tract that it's absorbing through. And so then you get better absorption overall because you're using different areas of the small intestine to bring that magnesium into the body, and then you're less likely for constipation. The other thing about reacted magnesium, or the other word for reacted is chelated. Basically, that mineral is attached to an amino acid. The importance of that is when that happens, the body, and again, this is the way I think of it too, is the body thinks of that more as a food source, and so it's more apt to be absorbed. Where the magnesium citrate, it'll draw water into the colon, and that's fine. It'll help as a laxative, but then you can go a little bit too far. So, I have patients that use both. Sometimes they'll respond more to better to the reacted or the chelated magnesium, and then I have some patients that just swear by the magnesium citrate, and they've figured out their exact dose, and that's fine too. But if that patient can't sleep, I'm recommending this one first. Let's see, the 5R plan. So this is just kind of general, overall GI health. So yeah, constipation is certainly getting, ideally get fixed with this, but we talked a little about removing triggers, trying to find out what those incompatible foods are for that particular patient. Like my daughter that had the issue with the dairy and the gluten. Sometimes we have to replace things. So like digestive enzymes might need to get put back into the picture. That could be a reason why you're getting constipated. You're not digesting your food all the way. And so do we need something like betaine HCl, or do we need digestive enzymes? We could do a stool, not that we can do it here, but go to your doctor, GI doctor. There's other testing that's out there that I can refer you to, that you can do a stool sample test and find out, how well are you breaking your food down. If you're not breaking your food down well, that could be the reason why you're constipated. Reestablish. So bringing good bacteria back into the GI tract. So maybe you were on multiple courses of antibiotics and you've got dysbiosis going on in your GI tract. That can lead to constipation. I have a lot of patients actually that come in They're on a course of antibiotics and they're constipated. They come in here, we put them on probiotics, and lo and behold, that fixes the problem. So again, but getting to the root cause of their constipation, right? That patient comes in, I, again, ask them my series of questions to figure out what's going on, and lo and behold, they just got done with a sinus infection. Well, I'm not going to give them magnesium, even though that would still benefit from them, but to solve their problem directly, we're going to go with the probiotic. And sure enough, given the probiotic, within a few days, their constipation issue's fixed. So you got to figure out what's really going on. So we do, if a probiotic, especially for patients that have been on multiple courses of antibiotics, we might recommend a stool test. We do have I call it a basic stool test here, where they're looking at the different bacteria and the different fungus in the GI tract. It's about $130. I have a whole seminar on it, but it's the microbiome test kit that we sell here. $130. It does take about 6 weeks to come back though. So it's not like a quick fix thing, right? We're doing a lot of other things up front, and then we send off the stool test. If that's something we're having a real tough issue trying to figure out somebody's constipation, we might have to resort to that. Repair. So test for leaky gut, repair gut lining if necessary. Maybe you've got all kinds of inflammation going on in your GI tract, and there's a whole storm or war going on down there. We have test kits here. Actually, I'm going to circle back a little bit here. With our food sensitivity test kits, the leaky gut tests are automatically included in those food sensitivity kits now. But
So
test for leaky gut. Yep.
is it important if you're like figuring out your gut lining? It's probably important to know what you're allergic to as well.
Yes, I usually start here.
Okay.
Because otherwise, if I'm testing microbes and everything else and leaky gut, I still might have a problem way up here. Yeah. The only drawback to this though is like the test kit that we have by KBMO, it's $375. So it's not cheap, but it tests 132 foods. So there's a lot there, and they have one even above that for another $100 more. It tests 176 foods. We get a lot of information from it, and we're testing for zonulin and candida, and there's a lot of information we're gathering there. But again, you can start basic and build your way up, but you get to a point where it's like you can spend a lot of time and money, trying all these different products, but if your diet is mucked up, and then rebalance, reconnect the gut and brain. Is that nervous system in the vagal nerve, communicating back and forth between our brains and our guts? We have to start looking at that and reestablish that nervous system if it's been, tampered with essentially. So I talked a little bit about this already, but remove those food triggers. Again, we have the KBMO food sensitivity test kit. You can just do, or you can do a food elimination diet too, right? If you come in, you're like, I don't have the $400. Okay, I'm going to tell you to cut out your gluten and cut out your dairy, and call me or see me in a week, and let's see where you're at. Yeah, that's a very easy place to start. The third thing I would probably eliminate is gluten, dairy, and then eggs. A lot of people register on eggs as being, again, they're sensitive to them, not that they're allergic to them. So, yeah. I'd even add just that list, just processed food in general. So I always say if you have to open up a wrapper or something to get into the food, right? Yeah. That's not a whole food. Yeah, man-made it, don't eat it is another way to say it.
Like protein bars.
Yeah, protein bar. Yeah, cereals. Yeah, muffins, bagels, all that kind of stuff. Yeah. Replace and restore. So adding in digestive enzymes if necessary, or maybe you don't have a gallbladder. I have so many patients that come in to the pharmacy. I don't know why, if it's unique to our location or what it is, but that's one of my questions too. Is do you have a gallbladder? I don't have a gallbladder. What do you mean you don't have a gallbladder? Yeah, they took it out. Where they put it? Tell them to put it back in.
Yeah.
Shake out the stones and just, right? Can't you just swap it in and out? Yeah, you need that
What
thing.
does the gallbladder do?
holds bile. And
Oh,
then bile is
yeah.
that surfactant that helps to emulsify and break down fats. Yeah, we need that. So, but if you don't have one, you're shit out of luck. No, I'm just kidding. So there's two kinds of enzymes. Digestive enzyme V, which stands for like a plant-based enzyme. So if somebody's a vegetarian, I'm not going to give them the ox bile enzyme brand. I'm going to give them this vegetarian-based enzyme. Now this breaks down fats, it breaks down proteins, and it also breaks down carbohydrates. So it does all three. It's broad spectrum digestive enzyme. Sometimes patients, again, they can be constipated, they can have fullness after eating, they can have gas and bloating. I'm going to say, yep, start taking that with every meal. Take it, depends on who you talk to. You can take it right in the middle of the meal. Take it 15 minutes beforehand. I usually recommend 15 minutes beforehand, and see how that works for you. If you don't have a gallbladder, I don't have a picture of it, but there's something called Orthozyme, same company by Orthomolecular, and there's other companies out there too, of course. I'm not getting paid to from Ortho to mention the products at all. Probably from Ortho, the YouTube crowd out there. But Ortho Digeszyme, it has ox bile in it, and that's for somebody that has their gallbladder removed because they need more bile to break down and emulsify those fats. So that can be the cause of their constipation. So add in some enzymes if necessary. Replace medications with non-constipating alternatives. We touched on that already, but like the beta blockers of the world or the calcium channel blockers. At least have that conversation with your physician. Yeah, can I get this switched over to an ACE or an ARB? I'm throwing out names here, but the point is switching it to possibly a different blood pressure hypertensive drug that isn't as constipating or doesn't have any constipation side effects at all. Maybe it's not possible, but something to look at. And then restore pH balance of the stomach, small intestines, and large intestines. What do I mean by that? So a lot of times, well, how do I know if my pH is off in the first place? And that's what's causing my constipation. Well, the first thing I'm going to ask you, are you on an antacid? I would say, I don't even know the numbers anymore, but we do med intakes on every single one of our patients, and I would say at least 30% of our patients that walk through here are on some type of antacid. And so then the pH of their stomach is off, and their small intestines and their large intestines. Or it's not ideal. I'll put it that way. No, I don't want to draw too many conclusions here, but that might be something we need to fix. Reestablish. I touched on this a little bit. These are my favorites. Something Orthobiotic 100. It's a broad spectrum probiotic. It's got 6-7 different strains in it. Sometimes that's enough to reestablish the microbiome. I will say with the orthobiotic or even any kind of broad spectrum probiotic, a couple of different things is you could be adding fuel to the fire when you give somebody a large dose of a multi-strain probiotic, and then they get worse, they get more. Basically, you enhance all of their symptoms that they came in here with. So that doesn't work well for repeat sales. Put it that way. So you just made everything worse for me. So if I don't know the patient very well or I just don't have enough information to go off of, I'll usually recommend the Orthospore IG first. It's much gentler. It's a soil-based probiotic. What do I mean by that? It's more like a spore-based. So these spores have to kind of regrow, so to speak, is the best way I'll describe it. Instead of just giving somebody a bunch of bacteria and they're going to knock out all the bad guys right away, you just create a bunch of disruption. These guys are going to come in a little bit more secretively and kind of knock off. There's only 3 different strains in here. They're just going to knock off some of the bad guys one by one. And so they're going to just do it at a much gentler rate. Same end result, but different approach.
Do you suggest daily, long-term probiotics? What's the...
Yeah, so for probiotics, depends on the patient. In general, I'm going to recommend long-term. And the only reason I'm going to have somebody stop a probiotic is if they fixed all the things that got them there in the first place. Did they clean up their diet? Did they identify what foods they were sensitive to? Those kind of things. Fix all their lifestyle issues. Are they drinking enough water? Are they taking magnesium? I kind of look at it that way. If they're eating fermented foods even too, they got to be doing that. If they're doing all of those things, then they shouldn't need the probiotic. Myself included, though, I'm in the camp of I got to take it every day, or at least every other day. Yeah, ideally. So, and shame, I'm giving you the honest truth here. Like, I'm not a good patient. Sorry. Maybe one day, right? I got to get to 120, but. So determine your microbial balance. Again, we can do a test. The standard process has this fantastic microbiome test kit. I mentioned before, it's $130. We can measure all your different bacteria. I can't remember how many it tests, 50, 60 different strains. Is it high? Is it low? It tells you about the good bacteria in your GI tract, the bad ones, different fungus, candida, kind of goes through all of them. And it gives you the good, the bad, and the ugly, essentially, is what it does. So, and then again, consider probiotics if necessary. For the repair side of things, so let's take that patient that's got constipation because of that antibiotic, or maybe they've been on an antacid drug for a very long time, or they're sensitive to gluten and they just figured that, they didn't realize it, and then all of a sudden they did a food elimination diet, and now after 3-4 weeks, their symptoms are gone. They might need to put things back together, so to speak, is the way I think of it, or repair that GI lining. I'm going to do that with either GlutaShield and or this IgG Protect. It's basically resealing up the fortress. It's kind of that more leaky gut fix, so to speak. And so GlutaShield does that. Even just probiotics can, I'm going to circle back here a little bit, but probiotics can actually improve the epithelial lining of the GI tract. So sometimes you can just get away with repair with just your probiotic. You're doing that reinoculation with the probiotic, and you're doing a repair process with the probiotic, and you can skip these other two products altogether. Doesn't always work, but again, depends on the case of the patient. But GlutaShield's like 10 products in one. I usually use that, not so much for that constipation patient, although I on occasion I do, but this is more that acid reflux patient that's having acid reflux and constipation. I'll use GlutaShield. Somebody that has a lot of food sensitivities, that's where I'll go with the IgG Protect. Or if they got leaky gut, I'll do the IgG Protect. IgGs is immune globulin G. It's just a protein essentially that helps with GI integrity, the barrier function. It does other things too, helps the immune system, but I'm not going to get into that tonight. So rebalance, I think I said all this already, but feed your microbiome with natural organic foods and fibers. So that's important. Eating different food, vegetables and fibers every day, not just the same foods week after week. If you eating different vegetables is going to give you different fibers. Those different fibers are going to feed different bacteria in the GI tract. Talked about fermented foods. I won't spend much time on that, but just sauerkraut's a good one. I start there. Eating smaller portions is helpful, not filling up your stomach too full. Fasting. I put fast. I missed the ing on there. Fasting. That's can even be helpful for constipation issues. So intermittent fasting. Stop. Only have a 4 to 8 hour eating window every day. Hard to do. Sometimes you got to kind of work yourself into it. Start with a 12-hour eating window and go down to 10 hours and go down to 8 hours. So there's value in fasting for a multitude of different reasons, but it can help with constipation as well. Don't eat when you're stressed, angry, or sad. I think I mentioned that before. That kind of goes back to the mind-gut connection. So if you're trying to digest your meal and you're emotionally upset, you're in that fight or flight mode, and you're basically shutting down your digestive tract when you're stressed or angry or sad. And so you can't digest your food properly when you're upset. So constipation is going to ensue, probably. So be aware of that. I mean, sometimes it's just something as simple as mindset, right? That kind of thing. Hormones and shit. My wife wanted me to put this. We do a lot of we do a lot of hormones here.
Yeah.
A ton of them. Bioidentical hormones is what I mean by that. Natural hormones. And so, if you're on hormone therapy and you're not pooping every day, that is a problem. And here's the reason why. Is those hormones, like your estrogen, your progesterone, your testosterone, those are the three that I'm mainly talking about here. If you're on that hormone therapy, and a lot of it's creams that we do here, or we do capsules on occasion, or sublingual drops. I don't care what type of dosage form you're on for hormones, but if you're on hormones, they're getting into your GI tract. And if you're not going to the bathroom every day, you're actually reabsorbing those hormones. Hormones are very lipophilic. Yeah, right? They're very lipophilic. They will just actually pass right through the GI tract again. So they're in the GI tract. You've got bile that's kind of wrapped them up and tried to package them. But if that stuff is just sitting there, they're going to pull back out of your GI tract and back up into your portal vein and come back up and go throughout your circulation again.
Yikes. So then your hormones get all off.
They get all messed up because you're not pooping. So you can actually fix somebody's hot flashes and night sweats. Usually they'll go on hormones and they'll feel really good and you've like fixed all their problems and like, I'm the best pharmacist in the world. And then they'll come back like a month or two later and be like, you were full of crap. No fun. And they'll be like, do you go to the bathroom every day? It's like, nah, 3 times a week. Every other day. I'm like, why don't we try some reactive magnesium? Get you pooping every day, get your stress level down, and let's see if those hot flashes go back away. Not all the time, but sometimes that's a nice little trick. Get them on a little bit of fiber, all those kind of little things. So, yeah, so it increases your risk of hormone reabsorption into the body and possibly creating more hormone dysregulation. So, side note on that. I think that is my last slide. Yeah, thank you. We can clap now, yeah, for sure. I am gonna end this and that is that.